That mental health conditions are common among people with substance use disorders, and how important it is for clinicians to be able to recognise and identify the signs and symptoms of those disorders, and to be able to then integrate that into their treatment planning. Secondly, that we need to be able to keep that focus on treating the person, not just the illness, and addressing all of the sort of complex and multiple needs that people might present with, which might involve many different health or social services.
That's a holistic approach to care.
That's right, yeah, a holistic approach, and ensuring that there is that good coordination and continuity of care for people. But also that people can and do get better. We do have effective interventions that work for many people, regardless of whether or not they have severe co-occurring mental health conditions. But having said that, they don't work for everyone, so we do still need quite a bit more research to try and particularly nut out what works for different patterns of co-occurring mental and substance use disorders. I would like to see in the next 5 years, mainly in terms of education and training for the alcohol and other drug workforce, that mental health play a core part of that training, whether it's undergraduate or postgraduate training as well, but also at the same time, education for healthcare providers more broadly on how they can effectively work with alcohol and other drug use
That's
as well.
education around comorbidity or education?
Yeah, but for both the substance use and mental health conditions, and across all health sectors, that there needs to be an awareness of those conditions, that people can identify them and realise how it might impact on a person's presentation, how they got to be where they are today, and then how to use that information to plan for their future treatment.
So I guess that vision ultimately end of the day is helps with clients, isn't it? It's ultimately the benefit of the client when you have that holistic training, that they're able to cope with people presenting with comorbidities and ultimately get them quicker.
Yes. Yeah, absolutely. If we have a more knowledgeable and skilled workforce, not to say that they aren't now, I mean we do have an incredible workforce in the alcohol and other drug sector, but the more that we can empower people to be able to learn more about mental health conditions, the better the outcomes are going to be for the clients of those services.